Our first speaker will be Chang on public health approach with increased time outdoors for myopia intervention in Taiwan. I think you're the other side.
Oh, okay.
We're alternating sides.
Thank you. Thanks for the moderator, Dr. Mark's introduction. It's my honor to present this topic, public health approach with increased time outdoor for myopia intervention in Taiwan. Public health approach to myopia, I think the first thing is awareness and recognition. The first thing is that people should know that myopia is a disease. Therefore, we just want to control. Otherwise, we just think it's a refreshing or just take prescription of glasses. That's all. But finally, children became adult. They will have a bunch of complications, such as cataract, glaucoma, retina detachment, myopia CMV, over 121 risk. So it's, in Taiwan, we recognize it's the number one blindness cause in elderly people. So Dr. Bullimore has summarized many studies and conclusion that myopia, each diopter matters, such as increase the risk of myopia macropathy up to 60%, retina detachment, each diopter increased risk 30%, glaucoma 20%, cataract, PSG 21%. Not only just only PSG is 21%. We know that nuclear sclerosis is also very early onset. Therefore, WHO has think that high myopia, defined high myopia can cause serious sight threatening. Therefore, it's defined it is a serious disease. But who will be candidate for the high myopia? It's our children. Once they become myopia, school myopia, in Asia, children mostly -1 diopter progression. So we think it's a chronic progressive disease. Early onset, then 5 years later, they will become high myopia. So it's a myopic tsunami, not only the incidence, but also the complications. But in many countries, such as in Australia, Cambodia, and Malaysia, Mongolia, Vietnam, most of the representatives from these countries think that myopia, the barrier of myopia is lack of awareness in the public. And also some misunderstanding that think that the LASIK, the refractive surgery, could cure the myopia. So we published a paper about even though you have the laser surgery, you still have the risk for the retina detachment. So awareness that child myopia is a disease, education, parents, teachers, careholders, and public keeping alert, prevention is essential. And the second is the recognition. We should know what's the real protective factor. So the review showing that the time outdoor is the most effective protective factor, and some other factor is risk factors such as near work, education, screen time. So in order to confirm that the outdoor activity is really effective for the myopia prevention, so in Taiwan we conduct a nationwide randomized school-based cluster randomized trial. The summary is showing that outdoor time 1 week spent 11 hours could have 54 lower risk for respiratory myopia progression. And also for the already myopia children, the myopia control efficacy is around 30%. Even though it is not up to 50%, but it still have partial effect. And we don't need to exposure to very strong sunlight, just the moderate light, such as in a hallway or under a tree, with enough time is enough for the myopia prevention. So several meta-analyses and a systemic review showing that outdoor time have more than 120 minutes per day could have is the most effective intervention, and there still has dose-response relationship. Once we know the protect factor, we need to promotion to let the people know, and that the people could do that. So strategy including rewarding, reminding, such as in Singapore study, they use the coupon to the national park to reward the children increase time outdoors. In the first 6 months, they got a very successful increase the time outdoors. In China, they also use the text message to let to remind the parents to bring the kids to go outside. So after 3 years, they got the myopia prevalence decrease up to 20%. In Taiwan, we, according to a WHO guideline, every school is the health promotion school. So it's a very big system to promote the time outdoor in school to prevent myopia. The third is policy intervention. So school policy, how to incorporate, this is the Taiwanese children, their curriculum in elementary school. They have 3 recess in the morning and 3 recess in the afternoon. So it's intermittent recess, have time to go outdoors. And we also, from the health promotion system to education parents, kids about the myopia is a disease and how to prevent that. So from several school-based programs to promote outdoor activity, we can see they got very good result, especially if it is a longer time outdoor and it is a compulsory policy, such as drug study. So we want to talk about in Taiwan, our experience. From 1980s, because the government think that myopia and children's vision is very important, and the myopia is very, they suppose it's a disease. So they use the unaided visual acuity screen in school. It can very high sensitivity to predict myopia. So school nurse perform unaided visual acuity screen every semester. The visual impairment less than 20/25, then refer to ophthalmologist. So there were several vision care programs conducted in Taiwan from 1980s, 1986, 1999, 2020, 2014. But myopia is a disease. What in Taiwan, 1980s, is just a concept, but it's not so popular in Taiwan in the public. In 2006, inside the health promotion department in Ministry of Health, I'm the member of the consulting member. So we promoted that high myopia is a serious public health issue. So from 2016, public announcement from the Ministry of Health that myopia is a disease. Then 2017, public announcement from the Ministry of Education for all the students to know that their myopia is a disease. So from there now, the referral system is more satisfied to the ophthalmologist. Before 2010, we have several measures to prevent myopia, but at that time, we just know the risk factor, the near work. So reduce the near work to looking at the far, change the light in the classroom, doing the massage exercise in the orbital. But the prevalence of the reduced visual acuity in primary school children, this is 1 million children data, showing that the prevalence of the reduced visual acuity increased, even though we do several measures just mentioned that. From 2010, in the advisory council, I proposed that outdoor could prevent myopia, and it was adopted. Then children to looking far and also bring them to go outside, and we promote is 10 120 is every day, 120 minutes per outside outdoor activity. So we can see the prevalence of reduced visual acuity initially change, decrease in every years up to 2019. But in the end of 2019, we know that the COVID-19 is happened, and children did not have enough outdoor time. So the prevalence of reduced visual acuity increased a little bit, but stable till now. In Taiwan, we used the atropine very earlier from year 2000, because 1999, Dr. Xu had published a paper that the 0.5% atropine is most effective. So at that time, the 37% children attempt to ophthalmology prescription 1% or 0.5% atropine. But after 2007, low concentration atropine introduced, and 50% were prescribed. That was showing that if we could retard the myopia progression up to 50%, then this population, the prevalence of high myopia will reduce up to 90%. So nowadays, the most updated data showing that the high myopia prevalence in Taiwan is reduced up to 10%. So who have the privilege to see the people suffer from the complication of myopia, and who have the privilege to know the risk of myopia, and can use the medical intervention, such as also the psychoplegic refreshing, especially to prescription the peripheral defocus. If you did not psychoplegic, then peripheral defocus theory is not satisfied. So ophthalmologists should take the responsibility to lead the eye care practitioner, education personnel, students and parents, and public health work and advocacy for the government. So effective public health approach for the child myopia is awareness and advocacy that myopia is a disease. Enough time outdoor could be beneficial for myopia prevention. Regular monitor psychoplegic from ophthalmology is very important. And promotion from rewarding, reminding, in cooperation with the health promotion system. And the policy intervention should need the cooperation with multidiscipline. Thank you for your attention.
We might take some questions after the talks.
Any questions?
Can I ask, with outdoor time in Taiwan, is there a seasonal variation between summer and winter? Is it easier to get kids outdoor time in a particular season?
In Taiwan, there was no particular season change in Taiwan, but there was air pollution, especially in the winter. So sometimes if the air pollution is reported a red flag, then we will not let the children go outside. So this is also a barrier for us. Yeah, but for the season change did not much in Taiwan.
Can I also follow with the outdoor time? Are there any geographical differences? Say in different region, the lust may be different.
Yeah.
In different regions, the lust may be different. What do you feel that kind of geographical difference from different regions? How can we ride on that or tackle that condition?
Yeah, because in the northeast Taiwan, the Keelung city, they have 180 days raining during the year. So it is difficult to promote the outdoor time. But we still encourage them, even though during the raining time, do not stay in the classroom. because even though in the raining time, if you go outdoor, the light intensity is over 20,000. So it's very good enough. So in the elder people in Keelung city, the myopia prevalence is not so high. But in our new generation, it's the same, similar to other cities. Yeah, so.
Yeah, just one question. In your photographs, you were showing like the classrooms which usually have a smart board. So with a smart board and good lighting in that room, doesn't it become a little strain to see the board and the children looking in bright light, because usually we would dim the lights when you have to see the smart board?
Yeah, previously we also think that because in 2016, the inventor of the Pokemon game, either will encourage children to go outdoor but play the smartphone. But after that, we saw that the myopia prevalence is not decreased, and also many children still became myopia because they addict to the smartphone, because they doesn't always play the Pokemon game. So even though the smartphone, the light is not enough to prevent myopia, because the most important risk factor is near work. The near work duration will be longer. So nowadays we notice that even though iPhone or Android iPhone, they have the time control by the app, so we can ask the parents to set the time limit for the children. Yeah. Okay. Thank you.
Sir, will you advocate UV light protection lenses for the children?
Light protection.
UV light.
UV light, yeah. In Taiwan, because our spectacle mostly have UV light protection, such as intraocular lens, and also we had blue light protection, but they did not protect the myopia prevention. Yeah, this is just only protection, but it did not could control the myopia progression.
But it also cuts the violet light that helps in the prevention in myopia.
Yeah. Mostly we will ask them to wear the hat and the sunglasses. Even though with the sunglasses, it still have, if you go outside, it has over 6,000 lux intensity to prevent myopia. So I think it's still good to promote wear the sunglasses.
Thank you.